as you can see, lips are very important, very, very important in the face. They have multiple roles. And the reason that we put the lips in the basic course is not because lips are simple. They're not simple. They're actually very complicated. An injection of the lips, it can be very challenging, specifically for people with more mature faces, small lips, would be very challenging. But because it's so popular, so common, then if you don't know lips, you're missing a lot of customers. So that's why you have to get really familiar with the lips. We actually have designed a master workshop just for the lips, which is outside of the regular program for people who are more interested in the lips. And we're discussing different type of injection techniques, a full day hands-on. I think our next course, if I'm not wrong, is on March 26th. If you're interested just for the lips, you can sign up for that course, and we're going to do one full day just focusing on the lips. That's how important are the lips. Number one, dermal filler in the millennials. Like all the young girls, because of the social media, because of other factors, they come to your clinic asking for the lips. So popular. So whenever you're dealing with the lips, having in mind that the lips are part of what? They're part of the face. So you cannot get the best result without looking at the whole face. The width of the face, the chin projection, the nose projection, the lips projection, all around the perioral regions are important. So then whenever you are dealing with the lips, look the whole face. Look at the proportions. Upper face to the lower face. Upper face to the whole lower part of the face, not just the lower lips. The upper part to the mid part, right? All these proportions are important. Projection of the lips are important. If you project the lips very nicely, but the patient has not a good projection of the nose, not a good projection of the chin, you're not going to get the best result. So all these things are important when you're injecting the lips. Gender is also important. Ethnicity is important. So we are seeing more and more male clients come to the clinic asking for the lips. We know that generally speaking, male are growing in the aesthetic practice, and lips are getting popular in male clients, but it's a big difference. Majority of the female, they come and they want a pouchy, projected fullness in the lips, specifically in the center of the lips. In men, they're asking more for definition. They want to have a little bit of more defined and a little bit of volume in the lips, but more symmetric, more equal in the center and lateral part of the lips. Ladies, more in the central. So you have to consider that, otherwise you're just feminizing the face. Again, on this slide that shows the projection of the lips are important. I always look at the tip of the nose, tip of the chin, and the projection of the lips. The other thing that is important is there is a lot of muscle attached to the lips. So perioral region, it's a very, very mobile with lots of movement. So whenever you're dealing with the lips, have in your mind that there is, first of all, because it's so much movement, most probably your filler is not going to last very long. And you need to explain your patient that. Just tell them that don't expect that the filler is going to last a year or two. No, it's not going to last, especially in the younger people. It lasts maybe a few months. And if they always want to have a nice and projected and full lips, they most probably need to top it up again every few months. Secondly, because there's so much movement, there might be signs of the aging around the perioral region that can be treated with a combination of filler and neuromodulators, such as lines in the upper lip, the DAO muscle, mentalis muscle, gummy smile, that all can be combined with the neuromodulators.